my name is Tabitha Baker, and I'm going to be doing a head and neck assessment today. I'm Brett. So for starters, we're going to look at the head, note any swelling, see if it's symmetrical on both sides. You also want to make sure there's no tenderness or swelling here. From there, we will then do not keep your composure, please. From there, we will then assess the sinuses, starting off with the frontal sinuses using the pads of your fingers. You're gonna just lightly touch here. It should not be painful, shouldn't have swelling. If there is, just meaning that the sinuses should probably be checked by like an ENT doctor. Same with down here with the maxillary. You're just gonna feel with the pads of your fingers right below the eyes here, noting any swelling, pain, or tenderness, which there should not be any. From there, we're gonna assess the TNJ, which is the transmandibular joint. I never say it correctly. You're just gonna place your fingers about right here at the jawline. Have the patient open and close their mouth. Open for me, and then close. Perfect. It should open and close symmetrically. Should be no pain and no tenderness. Also shouldn't have like a clicking noise or anything, because that can just state that it's kind of off track and swelling there. From there, we will then palpate and feel for the thyroid gland. You can do it from the side or you can do it from the back. The back is a little bit more accessible. You will come right around, place your hands on either side of the trachea, and then just feel up and down, noting any swelling, one side bigger than the other, any lumps or nodules. We do not want those. And then moving along from there, if everything's normal, we will now check the lymph nodes of the head right down here, the bottom of the head to the neck. We have the pre-auricular on the sides right here. We have the post-auricular right behind the ears. The occipital, that's a little bit further behind the neck, kind of down at the bottom of the back of the head. And then we have the superficial cervical, moving down a little bit further. And then you have the posterior cervical moving on down. And then right on the front, right above the clavicle, you have the supraclavicular around here. Right here in the front, you have the submental. A little further back, you have the submaxillary, then the tonsillar, and then down in the front here is the anterior cervical. You shouldn't feel any lumps, swelling. They should be non-tender. They should be non-movable, and they're very, very small. And if they're hard or movable, they have pain, then they need to be referred and have that checked. So that is the head and neck. Thank you.